हाँ जी, वेलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल ਦੇ ਉੱਤੇ। सो ਕੱਲ੍ਹ ਨੂੰ ਸਾਰਿਆਂ ਦਾ ਐਗਜ਼ਾਮ ਆ ਬਾਬਾ ਫਰੀਦ ਯੂਨੀਵਰਸਿਟੀ ਨੇ ਜੋ ਕੰਡਕਟ ਕਰਨਾ। ਮੇਰੇ ਵੱਲੋਂ ਸਾਰੇ ਸਟੂਡੈਂਟਸ ਨੂੰ ਬੈਸਟ ਵਿਸ਼ੇਸ ਨੇ। ਸੋ ਧਿਆਨ ਨਾਲ ਆਪਦਾ ਐਗਜ਼ਾਮ ਕਰਕੇ ਆਇਓ। ਐਂਡ ਆਪਾਂ ਕੁਐਸਚਨ ਪੇਪਰ ਇਹ ਬਾਬਾ ਫਰੀਦ ਯੂਨੀਵਰਸਿਟੀ ਦਾ ਸਟਾਫ ਨਰਸ ਦਾ ਐਗਜ਼ਾਮ ਜੋ 23 ਮਈ ਨੂੰ 2021 ਨੂੰ ਹੋਇਆ ਸੀ ਉਹ ਡਿਸਕਸ ਕਰ ਲੈਂਦੇ ਹਾਂ। ਸੋ ਇਹ ਐਗਜ਼ਾਮ काफ़ी रिपीट भी होया 2 बार। चलो स्टार्ट करते हैं। फर्स्ट क्वेश्चन सीगा हॉस्पिटलाइज्ड पेशेंट इज डिसओरिएंटेड एंड एक्टिवली साइकोटिक, सो विच ऑफ द फॉलोइंग इज़ द प्लान फॉर नर्सिंग इंटरवेंशन। सो ਇਹਦਾ राइट आंसर की सीगा ये मैं पहला भी डिस्कस करवाए ने बट एक बार आप पेपर के थ्रू देख लेने। सो ऑप्शन नंबर सी रियलिटी ओरिएंटेशन ਇਹਦਾ राइट आंसर सीगा। नैक्सट सैकेंड क्वेश्चन हैगा अ पेशेंट हैज़ प्रिस्क्राइब्ड डेजॉक्सिन 125 GG by mouth every morning, diagnosed with heart failure. So the pharmacy dispense tablet there contain 0.25 mg each. Being a nurse, how many tablet need to be administered in each dose? So कितनी administer provide करूँगी? Half tablet. So option A is the right answer. Next third सीगा a community health nurse should include which of the following when informing a client about healthcare services? Option A dependency on home care, nurse will develop home care will cost more than staying in the hospital. There are limits, advance in technology and greater autonomy and control over self-care fostered. So question number third the answer सीगा option number C. Fourth, which of the following is the best example of ethical dilemma faced by the nurse? Deciding whether or not to place a client in a private room. B. Deciding the order in which staff members should take their break. C. Deciding whether or not to ask another nurse to care for a complex patient. And last option is deciding whether or not to tell a client about the client diagnosis. So question number 4 the answer C. Deciding whether or not to ask another nurse to care very complex patient. Fifth, when counseling a pre-eclamptic diet about her diet, what should the nurse encourage the woman to do? A. Avoid simple sugars. B. Well-balanced diet. Restrict sodium intake and increase intake of fluid. So restrict करनी चाहिए sodium intake. So option C is the right answer. Sixth है when assessing a client admitted to the hospital for diabetic ketoacidosis. So which of the following clinical manifestation would the nurse accept? So ਇਹਦਾ right answer हैगा blood pH level below 7.3 ਹੁੰਦਾ ਜਦੋਂ so that is a diabetic ketoacidosis ਦੇ ਵਿੱਚ include ਹੋ ਜਾਂਦਾ। option D is the right answer. Seventh, the nurse will administer liquid medicine to a 9-month-old child. So which of the following method is appropriate? Administer the medication with the syringe next to the tongue. Mix the medication with the infant formula in the bottle. Allow the infant to drink the liquid from a medicine cup and hold the child upright and administer the medicine by a spoon. So option so question number 7 the answer की होगा hold करना child ਨੂੰ upright and administer the medicine by a spoon. Next 8th देख लेने आ। 8th हैगा the nurse hear the alarm sound on the telemetry cardiac monitor, quickly looks at the monitor and notice that the client is ventricular tachycardia. So nurse client room and reaching the client bedside. So nurse should perform which action first? So which action first? Action first open the airway. So D is the right answer of question number 8. 9th, an appropriate goal for a client with anxiety would be to. So appropriate goal की होगा anxiety दे लई ventilate her feelings to the nurse, establish contact with reality, learn self-help techniques and become desensitized to past trauma. So A. ventilate her feelings to the nurse. 10th, at 7 a.m. the night nurse hangs a new 500 ml bag of DNS and adjusts the flow rate to 35 ml as per order. So if the IV infuses at proper rate, how will fluid should the left in the bag when the day nurse make around at 11:30 a.m. So halfway through the shift 160 ml, 250 ml, 340 ml and unable to determine. So right answer ਇਹਦੇ ਵਿੱਚ ਕੀ ਸੀਗਾ C. 11th, the patient with 38 weeks of pregnancy is admitted in hospital in earlier labor. In earlier labor, patient is carrying twins and one of the fetus is breech presentation. Nurse assist planning care for the patient and perform following as per highest to lower priority ਕੀ ਬਣੂਗੀ 38 week of pregnancy ਆ hospital ਦੇ ਵਿੱਚ early labor ਦੇ ਨਾਲ patient admit ਆ ਵੈਸੇ ਤਾਂ ਇਹਨਾਂ ਦੇ ਵਿੱਚੋਂ ਸਾਰੇ ਸਹੀ ਹੋਣਗੇ ਪਰ ਆਪਾਂ priority wise ਕੀ ਇੱਕ nursing intervention ਹੋਊਗੀ option B D C and A option B D A C first ਤੇ attach ਕਰਨਾ fetal monitoring then prepare the patient for possible cesarean section and gather equipment for starting an IV and last is measure fundamental height. So option B is the right answer. 12th, during antibiotic administration the nurse inspect 2-day-old IV site on a patient who is neutropenic and observe redness without swelling. So patient complain tenderness. Which of the following intervention is the first priority to implement? So की first priority रहूगी informing the patient that I will need be changed to a new site. Option B is the right answer. So ये 13th question सी. Next हैगा question number 13th. Question number 13 ਦੇ ਵਿੱਚ ਹੈਗਾ which of the following descriptions of the dopamine hypothesis is accurate about the causes of schizophrenia? A. The kidney causes excessive amount of dopamine in the body that the kidneys do not readily excrete. And the right answer is ਇਹਦਾ ਹੋਊਗਾ there in an excessive of dopamine found in a synaptic clefts in the brain. So option B ਇਹਦਾ right answer ਹੋਊਗਾ. Next 14th हैगा वा when the purpose is to limit the incidence of disease by controlling causes and risk factors. So which of the following is right? Primordial prevention, primary prevention, secondary prevention, tertiary prevention. So primary prevention is the right answer. 15th, the issue that determine an incident of battery are patient has been given false information about the treatment and patient is judged incompetent constant to treatment and has received improper care. And the option C right answer होगा the care that patient has refused is forced upon them without court authorization. So option C is the right answer. Next 16th, an antenatal client is informing the nurse of her prenatal sign and symptoms. So which of the following finding the nurse determine pre-symptom sign of pregnancy? सारी सही होणगे बट आप priority wise दसने आ की आंसर होगा इन्हां दा option number C A B C and E. frequent urination, breast tenderness, quickening भी होगी, amenorrhea भी हो but uterine growth नहीं होगी. So option C is the right answer. 17th, ਇਮੇਜ ਬੇਸਡ ਕੁਐਸਚਨ ਸੀਗੇ ਇਦੋਂ ਜਿਹੜਾ ਪਿਛਲਾ ਐਗਜ਼ਾਮ ਹੋਇਆ ਸੀ ਉਹਦੇ ਵਿੱਚ ਵੀ 3-4 ਪੁੱਛੇ ਗਏ ਸੀ. ਸੋ ਇਹਨਾਂ 'ਚੋਂ ਇੰਸਟਰੂਮੈਂਟ ਦੱਸਣਾ ਜਿਹੜਾ ਨੇਜ਼ਲ ਸਰਜਰੀ ਲਈ ਯੂਜ਼ ਹੁੰਦਾ ਆਪਸ਼ਨ ਨੰਬਰ 3 'ਤੇ ਇਹਦੇ ਨਾਲ ਨੇਜ਼ਲ ਸਰਜਰੀਜ਼ ਕੀਤੀਆਂ ਜਾਂਦੀਆਂ ਨੇ. ਸੋ ਆਪਸ਼ਨ ਸੀ ਇਜ਼ ਦਾ ਰਾਈਟ ਆਨਸਰ. ਨੈਕਸਟ ਦੇਖ ਲੈਂਦੇ ਹਾਂ 18th. A 9-year-old is about to have surgery, so physician order nephrodine 20 mg IV appropriately. So container reads 50 mg ml. The nurse should administer option number C 0.4 ml. Option C is the right answer. Next हैगा 19th question. While monitoring 50-year-old client who is undergoing treadmill stress test, which client finding will require the most immediate action? So option number question number 19 ਦਾ ਆਨਸਰ ਹੋਊਗਾ ਜਦੋਂ ਹਾਰਟ ਰੇਟ 134 beats per minute ਹੋਵੇ. Option C is the right answer. 50. Which of the following would the nurse accept assess client with long term maladaptation to stressful events? So A pulse 100, blood pressure 150 into 94 mm of Hg and ulcerative colitis, profuse diaphoresis and diarrhea. सो ऑप्शन ए जो पल्स 100 ब्लड प्रैशर 150/94 हो जाए, then long term maladaptation to stressful events. Option A is the right answer. 21. A catabolic enzyme join two or more substance into larger molecule, cleaves a molecule into two or more parts. So option B is the right answer. 22. You are caring for a patient with T5 complete spinal cord injury. Upon assessment, you note flushed skin, diaphoresis, verb T5 and blood pressure 160/96. Patient reports severe pounding headache. So series of immediate nursing action from highest to lowest priority will be performed to. So the right answer की होगा दा right answer ਇਹਦਾ ਰਹੂਗਾ ऑप्शन नंबर डी। पहला एलिवेट करांगे हैड ਨੂੰ 90 डिग्री ਤੇ then place the extremity in dependent position, then loosen the constrictive clothing, then assess distend bladder and bowel impaction and correct the problem. So option D is the right answer. 23rd, patient who had recent surgery has been vomiting and becomes dizzy while standing upon go to bathroom. So after assisting the patient back bed, nurse note blood pressure is 55/30, pulse is 140. So nurse hang the IV fluid to correct this condition. So option 0.9 ns at an open rate, B is the right answer. ए सी 23rd तक। नैक्सट आप देख लेने 24th, पेशेंट विद सीरम सोडियम 115 MEQL, so been receiving 3% NS at 50 ml per hour for 16 hours. Morning the patient feel tired and short of breath. So what is the nursing priority? 24th the answer is to turn down the infusion. टर्न डाउन कर देना इन्फ्यूज़न ਨੂੰ, सो ऑप्शन इज़ द राइट आंसर। नैक्सट 25, नर्स इज़ केयरिंग फॉर अ पेशेंट आफ्टर सेरिब्रल एंजियोग्राफी विद कैथेटर इंसर्शन while are left grown. So which of the following symptom denote allergic reaction to the contrast medium? So option C, steroid is the right answer. 26, the four major principle of medical ethics are. So what is the four major principles of ethics are? Autonomy, beneficence, non-maleficence and the justice. Option A is the right answer. Next 27th, pregnant client is admitted to a hospital preterm labor. So what is the first nursing intervention? So first and nursing intervention की होगी monitor for contraction and fetal bellowing. सब तो पहला आप contractions देखनी है ते बच्चा देखना वा भी ठीक है। Option A is the right answer रहू। 28th, the client is immediate post procedure endoscopic retrograde ERCP. So which intervention should the nurse implement? Assess rectal bleeding, increase fluid intake, keep in spine position, assess gag reflex. So assess करनी है rectal bleeding, A is the right answer. 29th, a 5-year-old child with high fever vomiting, doctor order acetaminophen 80 mg per rectum. So which of the following action nurse is appropriate? So आप की करांगे बच्चे मेडिसिन दे लई, आफ्टर मेडिकेशन होल्ड द चाइल्ड buttocks together. So option number B is the right answer. Option B is the right answer. 30th, you assess a client you just return to the recovery area after undergoing coronary arteriography. Which information is most concerned? Pedal pulses are palpable at +1. So A is the right answer. 31, a nurse priority related to client who are experiencing clinical manifestation of borderline personality disorder should be to. So A the right answer की होगा option number A, set limits when the client exhibits threat of life damaging behavior. 32, amylase has all the following properties. So question 32 the answer की होगा it cleaves proteins into amino acids. 33, patient who is psychotic and just seriously cut his throat with plastic knife after hearing voices telling him to kill himself in his fashion. So mention priority nursing goal to consider. So option A, The physical condition is will stabilize, patient will not harm self, and patient will free of auditory hallucinations. Next, patient will identify new coping strategies. So option A is the right answer. Next, 34th, nurse is caring for a patient post-operatively who develops sinus tachycardia. Which of the following nursing intervention? Apply warm blanket, administer atropine sulfate, position the patient in left lateral position, and manage the patient anxiety. So apply warm blankets. So option A is the ਰਾਈਟ ਆਨਸਰ ਰਹੂ। ਸੋ ਸਾਰੇ ਜਿਹੜੇ ਇਹ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਕੁਐਸਚਨ ਆਏ ਸੀ ਇਹ ਐਨਕਲੈਕਸਡ ਬੇਸਡ ਕੁਐਸਚਨ ਸੀਗੇ, ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਨੇ। ਤੇ 35 ਦੇਖ ਲੈਂਦੇ ਹਾਂ। ਨਰਸ ਐਡਮਿਨਿਸਟਰ ਵਿਚ ਆਫ ਦਾ ਫੋਲੋਇੰਗ ਪ੍ਰਿਸਕ੍ਰਾਈਬਡ ਡਰੱਗਸ ਫॉर द purpose of relieving both negative and positive clinical manifestation of the schizophrenia. So selective serotonin reuptake inhibitor, option A is the right answer. 36, terminally ill patient husband state, I wish I would have not cancelled our trip last year and kept putting it off, feel about it. So nursing student represent the statement indicating which of the stages of adaptation to dying. So right answer is की होगा depression. 37th, which of the principle must be, थोड़ा क्लियर नहीं आ रहा बट मैं कोशिश करूँ भी हो जाए। To the certain that any risk involved in medical treatment or prevention in outweighed by the benefit for the patient. Autonomy and privacy, dignity and justice, beneficence, non-maleficence, ethics and beneficence. So ਇਹਦੇ ਵਿੱਚ right answer ਕੀ ਹੋ, autonomy and privacy provide करना। 38, which of the following client is highest risk for pseudocrisis? So option 38 question ਦਾ right answer हैगा client with multiple miscarriages are the highest risk for pseudocrisis. B is the right answer. 39, client is admitted with Hashimoto-thyroiditis. Nurse is aware exhibit sign which of the following? Hyperparathyroidism, hypoparathyroidism, and last is hypothyroidism. So right answer is option number D. 40th, the nurse should implement what precaution for a client who has scabies? So right answer is standard precautions and contact precautions. So option number C is the right answer. ਸੋ ਇਹ ਅੱਜ ਆਪਾਂ ਡਿਸਕਸ ਕਰ ਲੈਂਦੇ ਹਾਂ। ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ ਆਪਾਂ ਨੈਕਸਟ ਕੁਐਸਚਨ ਦੇਖ ਲਾਂਗੇ ਵੀ ਕਿਹੜੇ ਕਿਹੜੇ ਆਏ ਸੀ, ਕੀ ਆਨਸਰਸ ਨੇ। ਸੋ ਇਹ ਬਾਬਾ ਫਰੀਦ ਦਾ ਐਗਜ਼ਾਮ ਪੇਪਰ ਆ ਜਿਹੜਾ ਪਿਛਲੇ ਸਾਲ ਆਇਆ ਸੀਗਾ, ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਆ। ਸੋ ਕਿ ਮਿਲਦੇ ਆ ਨੈਕਸਟ ਵੀਡੀਓ 'ਚ।